Well, some New York lawmakers are trying to expand access to reimbursement for doula services in Medicaid programs. Our New York Capitol correspondent Elise Klein breaks down the recent legislation and issues around it.
The state Senate recently passed a bill intending to expand access to doula services. It would require the Department of Health to establish and maintain the New York State Community Doula Directory for doulas accepting Medicaid.
The individuals on Medicaid can find a doula, they can interview them and see their credentials and et cetera, so that they can find someone that they trust to take them through what, should be a very joyful time in their lives. But myself included, it can also be a very daunting time.
A community doula is a trained professional who can offer emotional, educational, and physical support to an individual before, during, and after childbirth. Some doulas working in New York say this support is important for birthing individuals, but access can be challenging.
Right now, some of the people who need doula support the most are not able to afford it, and expanding Medicaid coverage to reimburse doulas would allow more people to be able to access doulas and also allow doulas to be able to work more sustainably.
We're joining people before their medical teams and we're staying with them afterwards. So that time needs to be considered, and doulas need to be paid a rate that makes this a living wage so that we can support our families and support ourselves.
In 2019, the Department of Health launched a doula pilot program to extend the state's Medicaid program to cover doula services in Erie and Kings counties. Senator Brooke says because this pilot is only available in 2 counties, access is limited. Brooke adds access to doulas can do more than just help New Yorkers through their birthing journey. It can also help combat maternal death. According to the New York State Department of Health, Black women are 5 times more likely to die of pregnancy-related causes compared to white women.
So when we think about, doula care and expanding it, it's also a racial justice issue and it's a birth justice issue, right? It's making sure that we have more equitable outcomes, and we're trying to get rid of these disparities while we tackle the crisis overall, too.
In Albany, Elise Klein, WNY News Now.